Well, tonight, Iowa is one of 5 states where anxiety, not a problem with the shots, caused reactions in dozens of people at vaccine clinics. So joining us to talk about vaccine anxiety is Dr. Kevin Carroll, Vice President of Behavioral Health at UnityPoint. Dr. Carroll, thank you so much for being here.
Thanks for having me.
So I'm having a hard time really comprehending this. What is this phenomenon that some doctors and vaccine administrators are seeing?
Yep, this is a common reaction. The fancy word is it's a psychosomatic response. And really what that means is that our mind kind of tricks us into having a physical response. I think the most common kind of analogy that people might relate to back when they were in school is if you had a big test and you were really nervous about the test and maybe you had an upset stomach or even threw up because in anticipating that difficult test. It's the same concept applied here with this new vaccine.
So just to be clear, this anxiety is triggering physical symptoms in some people.
That's right. Either for some people, this is not about the COVID vaccine. It happens with other vaccines. Maybe they're afraid of needles or things like that. Other people, it might be specific to the COVID vaccine and all of the hype, if you will, that's accompanied it, that they just are thinking about it a lot, worried about it, worried about what might happen if they do or don't get the vaccine, resulting in some physical symptoms that are very real.
Are certain people more susceptible to have a reaction like this?
To my knowledge, just past history, maybe with vaccines or shots, might be the subpopulation. But other than that, I think it can happen to anyone.
And are there warning signs that this is anxiety related, not necessarily a physical reaction to a vaccine, or is that something that has to kind of be looked into down the road?
I think family members can assess this with their loved ones or people themselves just by kind of tracking kind of the people's feelings and thoughts about the vaccine itself. Most people have a little bit of apprehension. Nobody's fond of getting shots. But if someone is really kind of ramping up their concerns or how they're verbalizing a real significant worry, it's something to talk through. And then, with conversation, a lot of patients have their fears relieved, that any kind of stress or anxiety that they might be experiencing on the short term is somewhat normal and will dissipate as soon as the shot is administered.
All right, easy enough. Dr. Kevin Carroll with UnityPoint, thank you so much for your time tonight. We appreciate it.
Thank you.